This is Restorative Medical's Safe Boot 2. We also have them in the pediatric version. They're little contracture boots. They have the non-skid sole. They start at 3-inch foot and work up all the way to, there's an 8-inch pediatric boot. The boots for the adults start with a small is 8-inch, medium is up to 9.5, large is up to 11, then you have your extra large, and we've even made them larger than that. I think the extra large is 13 inches. So you go right from the pediatric all the way up. But the pediatric version of the boot that's 8 inches is more narrow. So if you have an adult that has a narrow up to an 8-inch foot, then I would order the pediatric version, and it also has the flex straps. This boot has a bit of an arch. It has the toe up style that helps you with ambulation. When you're walking, you should walk to the outside of your foot. Your foot should go to the outside, and then at the last second, this toe off helps lift your foot and helps you in appropriate walking and ambulation. So it's very good for that. Now this is not, it's not a boot for a severe contracture, for severe plantar flexion contracture or inversion, eversion, or ankle contracture. It's fine for mild. It's a boot, it's not meant to go to the grocery store, but you can walk around a small apartment. You can go from bed to chair, chair to commode, this sort of thing. For ambulation training, therapists like it for that. It has our silky lining on it. It's very comfortable. It's very easy to put on. I'm going to open the upper flap. You're going to open the talus strap. It's very important to keep people's feet at 90-degree angles. If we don't keep people walking and they're allowed to go into a chair, then we, by human nature, are fairly lazy, and if they're not motivated, then we're not going to get them out of that chair. So we need to keep their feet. It's very important to prevent foot drop and deformities. Many of these start with brain injuries and spinal cord injuries the 3rd day after that accident, and they're still in the ICUs. And the tone can start, that neurological tone that causes inappropriate muscle contractions. So you'll see a twisting starting, maybe one-sided, maybe both. So you want to prevent flaccid foot drop. If they're in bed, you want to prevent pressure on the heel. So you want to have a boot, all our boots suspend the heel, so there's no potential that they're touching a surface. But it's very important to stop that contracture, that tone in the ICU or wherever they are when it begins, because if not, it's going to continue to progress. And we want them to go from the hospital to the rehab with no deformity, and through the rehab home, hopefully, or wherever they're headed with no deformity. So we open this up. We're going to put it on the patient. I have the patient's foot here. We're going to put it on and seat their heel down back in the device. I'm going to hold securely on their foot and make this snug, not too tight. And I always take my fingers and run it under the padding, between the padding and the patient's skin, to make sure it isn't too tight. The same here, that's to anchor it on. Then we put the talus strap on, and this is the important part, to suck that heel right down in the boot for good 90-degree alignment. You want to make sure it isn't too tight, and always you can feel the top of the patient's foot for the pulse. make sure that we haven't restricted any blood flow. You're going to look at their toes. Are their toes normal color? Are they blanched looking? Are they red? These are all very simple signs. If the patient can tell you that if they have numbness or tingling in those toes, then you want to make sure you loosen this up. But just a few precautions will keep you safe. Now, the way the talus strap is designed is to allow for very large circumference at the ankle. You might have someone with congestive heart failure or other issues that cause them to be quite large. They may have some condition where they're swollen right now, but that swelling you anticipate will go down and it'll be smaller. So I wouldn't cutting this off if it's a temporary condition. But if you fit your patient and you feel pretty sure that this is where they're going to be, then you can adjust this. If it's way too long, then you can trim the black part off. But the hook material goes all the way around, so you just smooth it, and that gives a nice secure fit. The non-skid sole comes off when they're in bed, so you leave what germs were on the floor and not in the bed. Then when you get them up before they stand up, just smooth that back. Now, as far as the flex straps, they have elastic properties. So if your patient has tone, they're able to push through that tone with that tension that's going to bring them back, push through the tone, the resistance holds them there and brings them back. And you might see them actually working like this, or you might just see a tension. Whichever, in about 15 minutes, you should see a relaxation as it's working through the central nervous system. We don't just take people and shove them up. You can't just push them into 90 degrees back to normal. We have to allow the body to work through its process to relax, and that is that flex technology type of resistance to the stretch. If this boot can be heat molded, it's very simple. See the Kydex? You would take the padding off, you would heat it where it needs to be molded, and you can refer to our restorative medical website for those specific instructions. But again, this is a little bit more toward the orthopedic side. It's a little heavier heat moldable plastic. So if your patient has ankle contractures, inversion or eversion, then I would refer you to one of our restorative boots, more for contractures. This one is great for that beginning tone, in the hospital or wherever, but it's good for orthopedic conditions too, where you just need a boot to get you through a period. The flex straps, if you do have mold this down and want to start tugging it back up, so they're very adjustable. So you put them where you need to allow for whatever mold or whatever tension you want. You can move this up and down for where it's appropriate for your patient, where it does the most good to pull their foot up to give that tug. Always remember though, you want to continually bring it back up because you want to continue to restore that patient. Now if you have inversion, eversion, and you're using this boot, whichever side it's going toward is the one you want to make tighter. So if my foot is going in this direction, then I'm going to tug this one a little tighter just to start correcting that. And this again is Restorative Medical's Safe Boot 2.